Serum thyroglobulin is a marker for thyroid cancer, and there are some limitations in its measurements and able to interpret them in the management of patients with differentiated thyroid cancer. There are three things that will change serum thyroglobulin. One is mass of tissue, i.e. how much thyroid gland is left. Two, damage, either from radioiodine or surgery. And then three, the TSH level will influence that value. So in the management of patients with thyroid cancer, in terms of thyroglobulin, what you want to do is make sure that the TSH level is constant, and then you can use that value to determine the amount of residual tissue after thyroidectomy. In addition, there are other problems with thyroglobulin measurements, and that has to do with the ability to measure it. The first is because of monoclonal antibodies recognizing different epitopes, and each lab has their own monoclonal antibody. You cannot switch lab to lab. You have to stay in the same laboratory to ensure stability of your thyroglobulin value. If, for instance, your laboratory changes methods, then that patient has to have a term called rebaselining for the physician to better understand what that thyroglobulin measurement means in the new assay. The other is thyroglobulin antibodies. 25% of patients with thyroid cancer will have thyroglobulin antibodies, and they will actually interfere with the measurement. That's serum thyroglobulin. In current assays, there are two techniques currently available to rectify the presence of thyroglobulin antibodies. One is liquid chromatography mass spec, and the other is radioimmunoassay. In studies comparing radioimmunoassay to chromatography mass spec, about half the patients with the mass spec methods will have a severe underestimation of thyroglobulin values, while those who have their values measured in radioimmunoassay techniques actually are able to follow those thyroglobulin values. The keys to this are A, make sure your TSH level is constant so that thyroglobulin value really reflects residual disease. Two, cannot switch laboratory methods. And three, in the presence of antibodies, perhaps radioimmunoassay is the best technique to measure those. And just finally, the ongoing studies certainly suggest that perhaps just following the thyroglobulin antibody levels instead of using these more sophisticated technique may allow an accurate determination of presence of disease and long-term management.